So hi everyone. Thank you very much for joining us today at this roundtable. My name is Festus, and I am the um, lead researcher for the African Center for Digital Health Policy Research. As you all know, that we have significant limitations in Africa at the moment in terms of importing and applying digital health tools and technologies to the health situations in Africa. So apologies for the delay, everyone. We are very sorry. We had a bit of a technical delay with our guest speakers, but I think we do have our guest speakers here. If your name is not correctly within your handle, can you please just change your name so that we know? So just go to your Zoom handle and change your name so we could pronounce your name correctly. Thank you to all our fellows and senior fellows at the center. Lovia Fokwa is here, and I'll be handing over to her shortly. Tony Ajiboye, one of our fellows, is also here. Usman Gaku, one of our senior fellows, is also here. We also have Maria Shea, who is also one of our senior fellows. And we do have other guests who have joined us today. So can you just change your name? Oh, we have Edward Lubega. Please forgive me in case I mispronounce your name. Apologies. So Edward is here. Thank you very much for joining. We know you had a bit of technical delay, but we are still very much pleased to have you join us. To change your name, thank you very much, Tony, for that. To change your name, just click on participants, click on Usman Gaku and rename your profile so we could name you, we could call you and address you correctly. If you can't turn on your video, that would be good. It's good to be able to personalize our interactions if we can see your video, so that would be great. The African Center for Digital Health Policy Research have held several roundtables this year, and we're very pleased to be contributing to the conversation in Africa. By the way, my name is Festus Adedoyin, and I am the lead researcher and founding fellow for this center. I currently lecture at the Department of Computing and Informatics, and I lead on our integrated digital healthcare projects within the department. I also have a number of research publications around this area and some ongoing projects and collaborations with companies in San Francisco and companies in Nigeria as well. We, as a team, have decided to host this roundtable, and our goal is, again, to contribute to the debate in Uganda. Uganda is a great country. And again, this is just a brief welcome. In 4 minutes or less than that, I will be handing over to Lovia Afuakwa, who will be leading this roundtable alongside with Joanne and Maria and Daniel. So what we're looking at today is very important. We are trying to see how digital technologies can transform our health sector. Africa has a lot of resources. We have enough resources to finance innovations and technology, to save lives, to make processes easier. For example, at our last roundtable, we were talking about the Gambia, how the Gambia has adopted smart immunization for children, and polio vaccinations and all kinds of vaccinations, trying to use electronic record processing and digital tools to make sure we have a much more robust approach to immunization in the Gambia. These are some of the innovations that we're looking to exploit. Unfortunately, we do not have sufficient policies from the government that gives us a direction. How should we approach investment in digital health space? How do we attract foreign investment and maximize them appropriately, as some companies are currently doing in Rwanda, in South Africa, and so on and so forth. So I want to welcome everyone once again to this roundtable. And please, if you have just joined us, kindly change your name in case your name is not currently being spelled correctly. We do have a few people who have joined, and their name currently appears as Usman Gaku. So please kindly do change your name so we could address you properly. Welcome Nemosinma, welcome Balire, welcome everyone, welcome Daniel. And I will hand over to you, Lovia. Thank you very much. Thank you. So welcome to this roundtable, and I wish us a very fruitful conversation. Thank you very much.
Okay, thank you very much, Doctor, for that warm welcome. Thank you all very much, our cherished participants, for joining us at today's roundtable. We are excited to have you on board, and we know that we are going to have interesting discussions. Kindly join in, or you can text in the chat box when you have any concern, remarks, or questions. So just like our lead researcher, Dr. Festus mentioned, we are just about starting. And before I start, I would like to just give us a bit of housekeeping. I just want to inform all of us here that the session is being recorded, live streamed, Facebook and YouTube. You can kindly invite your colleagues, your friends, and all stakeholders, or anyone who is interested in digital healthcare to join. Also, we will urge all of you to mute your mics to avoid distractions. Thank you very much. We are also on all social media platforms. We are on Facebook, we are on Instagram, we are on LinkedIn. Kindly join us on all these platforms. We also have our website. I'll type in our website address shortly in the chat box. Then we can all have a look or visit our website. So my name is Lavia Afuakwa. I am with the National Development Planning Commission in Ghana. I'm a principal planning analyst and a resource mobilization and partnerships officer at the commission. I'm also a senior fellow at the African Center for Digital Healthcare Policy Research. And I'm going to have a very simple exercise. I'm basically going to welcome you all, give the overview of the roundtable. I think Dr. Festus even did a session or a part of the overview. And so I will not delve so much into it. After that, we will have our first panel session that is going to be led by Juan, who is a fellow at the center. We're going to have a second panel session and then be round up. So it's basically going to be a very simple dialogue or roundtable discussion, and we hope that you enjoy. So if you can all kindly settle so that we start officially. This is our fifth roundtable. And I'll quickly go over, the overview of today's roundtable. So basically, as outlined by UNICEF, SDG 3, focusing on health, good healthcare, aims to prevent needless suffering from preventable diseases and premature death by focusing on key targets that boost the health of a country's overall population. Regions with the highest burden of disease and neglected population groups and regions are priority areas. One of the main ways to achieve this goal is to invest in successful digital healthcare projects with various stakeholders that matter when influencing outcomes. And that's why we have all of you here. One of such stakeholders is the local or central government that supports creating a workable environment. In many African countries, the government as a stakeholder seems to be severely challenged. I think Dr. Adejoyin mentioned this, and limited in the ability to support innovations in the healthcare space for several reasons, which may be reasonable or unfounded. So given these reasons, policy making that accentuates a conducive environment are not readily available. This deters local and foreign investors in committing to the development of the digital health sector in many African countries, even though, some few African countries are doing well. Consequently, this roundtable is aimed at highlighting these issues and suggesting ways forward in terms of specific action points for government as a key stakeholder in digital healthcare transformation. One unique attribute of this roundtable is that it draws knowledge and expertise from academia, industry, and representatives of the government to have a holistic view of the healthcare space and the way forward. Hence, our rich panel members will be sharing their areas of expertise and the way forward in the area of digital healthcare with us. Basically, the objectives of this roundtable is one, to discuss the challenges that adversely affect innovations in the digital healthcare space in Uganda. And then secondly, to highlight the way forward and specific policy changes urgently needed in addressing the challenges that we are going to identify. Can we kindly mute? Thank you very much. So the expected outcome of this roundtable is policy accept for leaders of Uganda and other African countries. So if you check or if you visit our website, you will note that our first, second focused on, I think the first one was Nigeria, and then some other African countries that we've had discussions on. So we are going to have policy accepts. These policy accepts are going to be put on our website for future leaders or for reference going forward. With this opening, I know Doctor has welcomed us, so I just want to formally welcome all of us to this roundtable. As I mentioned earlier, if you have any question, kindly drop it in the chat box, or you can raise up your hand and then we will call you. So thank you very much for joining. We are excited and we are privileged to have you all on board to share your experiences. I'll hand over to my colleague, Joanne, to take over the first panel session. Thank you very much.
Thank you very much, Lovia. I hope I'm audible enough.
Yes, hello. Yes, we can hear you loud and clear, Joanne. Thank you.
All right. I would like to first introduce our guest speakers. We have Edward Lubega. I hope he's in. We also have Nimsima Brighton. We have Dr. Falidi Sanyu, and we have Faith Acheng Lydia. Edward Lubega is someone is entering, okay. Edward Lubega is an IT specialist. Just a minute. I'd like to first introduce to you the guest speakers we have. We have Edward Lubega, an IT specialist. He's a marketeer, a business administrator, and a data analyst. He's also a pastor and has 10 years working experience in the edutech field, implementing e-learning initiatives for secondary schools, including digital science and virtual labs. You're most welcome, Edward.
Thank you.
We also have Counsel Nimsima Brighton. Counsel Nimsima is an advocate at the High Court of Uganda. He works with Kabusu, Muhumuza, and Company Advocates, and also a lecturer at Uganda Pentecostal University. You're welcome, Mr. Brighton.
Thank you so much.
We also have Dr. Sanyu Falidi. Dr. Sanyu holds a Bachelor's of Medicine and a Bachelor's of Surgery from Makerere University. He's also CEO at St. Joseph's Medical and Surgery Center, Mukono. He's a general practitioner with a deep passion for maternal child health. And Finally, we have Faith Lydia Acheng. She's also a counsel and a women leader at Kawempe Empowerment Center. You're also most welcome, Faith. I just want to believe that all our guest speakers are on. Could we just check and see if you're on? Is Edward on?
Yes, I am.
Good to hear. Do we have Council Musim to Council Brighton on? Sorry about that.
Yes, please. I'm here.
And do we have Dr. Sanyu on? Do we have Dr. Sanyu on? He had earlier told me that
yes,
he was.
I am on.
Okay.
I am on now.
Okay, that's good to hear, and good to see you at the roundtable. Do we also have Faith Acheng on?
Yeah, on.
Wow, that is good to hear. Thank you for joining this roundtable. You're most welcome, and we hope to have the best out of this. I would straight go to the first session, where we would be having Dr. Falidi and Edward Lubega taking the first presentation, which will focus on innovations in the digital health care space in Uganda. And I'll begin with Dr. Falidi. After his presentation, we would also have Mr. Edward Lubega, who would also make his presentation, which will focus on the challenges that are affecting innovations in the digital health care space in Uganda. Could someone mute? There's a lot of noise. Could someone mute? Thank you. After Dr. Falidi, we'll have Mr. Edward Lubega, who would also make his presentation, which will focus on the challenges that are affecting innovations in the digital healthcare space in Uganda. And after their presentations, participants will be given the opportunity to make comments or ask questions. Each of them will speak for about 15 minutes. Please, Dr. Falidi, go ahead and make your presentation.
Hi, everyone. I'm glad to be here. Are you all listening?
Yes, we can hear you.
Hello?
Yes, thank you.
Yeah, I'm glad to be here to present to you about the digital health care system here in Uganda and the current state. Those who have joined us, you're most welcome. To start with, digital health is a broad multidisciplinary concept that includes concepts from intersection between technology and healthy care. When we talk about digital health, we also apply to these digital transformations and how they help in the healthcare field, using the incorporation of this software, hardware, and the provision of services. The current state of Uganda in digital health is led by the Ministry of Health. As we all know, Uganda is one of the non-key players in the digital health system of the entire Africa. Like, we have a lot of innovations here. Though our Ministry of Health does not work alone, it works with a lot of NGOs, WHO, in collaboration with WHO, and other strong USAID. There are several NGOs and then the private sector. The role of the Ministry of Health in our health system is to collect resources and investments and align them according to need and according to the policy framework. As part of my presentation, since I'm practicing, like, I provide services, I thought wise to talk about a particular section in the digital health transformation innovation, especially here in Uganda, that puts more emphasis on telemedicine. Like telemedicine is just part of a bigger picture of the entire thing. But to be on point, for it, it's so specific on how these healthcare innovations coordinate between the patient and the clinician. Like you offer a service via the technology, like the technological services available. We are glad here that 8 years ago, five innovators, entrepreneurs, and doctors came up with a classic rocket health system here in Uganda. In this, a patient can directly contact a doctor via a phone call or computerized system, and the doctor gives, if it's a small issue, gives an advice to the patient. If it needs testing, they reach onto the patient and take off a sample, and if it needs medication, they still go on and treat the patient. If this needs monitoring, like maybe this patient is chronically ill, they need monitoring, maybe they have their glucometer at home or their BP machine, the doctor just calls, today morning, how was your blood pressure? It was ABCD. So I urge you maybe continue taking the medication, and so on and so forth. And it came out very important when we got a pandemic here, the COVID-19, where we had a lot of restrictions that patients could not move close to hospitals, and even hospitals were overwhelmed with a number of COVID patients. So other patients, maybe who had minor illnesses that are not specific COVID, would not be advised to enter into a healthy facility. So telemedicine had to come in. You call your patient, you are used to going to the hospital the patient is used to go to the hospital each and every month, maybe to refill the pressure medicine. Are we together? Or to refill maybe their ARVs, or even for just a blood checkup, maybe they have malaria, but not COVID. There were restricted movements, and telemedicine came in. It was easier. Doctor contacts you, a patient contacts a doctor, and the doctor collects or picks the history from the patient. Initially, it is when the two are in the same premises, but with digital transformation, with telemedicine, patients could get an opportunity to engage with a doctor who is very far, and probably get advice, as I said earlier on, or in case they needed tests, they could have those tests taken from them at home, because ambulances and doctors were allowed to move, but not patients, specifically in Uganda when COVID was worse. And the case of treatment, as I said earlier on, the management used to go on well. Telemedicine, apart from the pandemic stages, like after COVID-19, our patients actually picked it up here in Uganda. Still now, I can have a fever in my office and contact a health worker and tell them, I don't feel like moving, but I have a fever, I have a headache, and probably they advise accordingly. They either come with a first aid at my workplace or at home, at my convenience, or they go on and pick off my samples and then give me the response later. Technology in this way helps a lot, because patient data is stored well. Anytime patient contacts you, you can easily remember, oh, this is valid, and last time we were with valid, maybe he has history of ABCD. Just in a glimpse, like in a blink of an eye in your system, if you capture all that with this technology, which is hard with what we normally see in government facilities, or we normally used to see long ago, where patients have a book, all papers, and it's hard to get their recordings, it's hard to get their data, their database. Every time patient comes to hospital, we're supposed to ask them their name, their age, supposed to take their height again. Okay, we tell them you can still check the weight, but the heights, there are some things that are constant when you're managing a patient. With technology, you can do much more. Like you already have a lot of the patient. You don't need to do this groundwork again and again. Another aspect that I came across was about the use of this technology, not in diagnosis alone. Like there are more advanced technology making diagnosis of a patient depending on their complaints. But now here in Uganda, in some hospitals, like Women's Hospital, or they can do robotic surgeries. Like a patient has issues, so there is an intervention of management surgically, not only treatment medicine alone.
Hello, Dr.
Advanced
Falidi.
technology in the management of a patient. Yes, please.
Yeah, at one time we
Hello?
had lost you, but
Yeah,
at one
welcome
time
back.
we had
Yeah.
lost you, but you're back now.
Yeah.
Continue, please.
Yes, I was talking about the different innovations that are happening here, like in our what? Management of a patient. Since as earlier on I told you, since I'm practicing, like since I'm into a lot of practicing, I will notably talk about those elements of I'll talk about those elements where medicine and technology are used in providing a patient service or an intervention at hand. And I noted the diagnostics, and then I've talked about the robotic surgeries. Yeah, that's the far I can give now. I think we can pick up more and more as we go on.
Thank you, Dr. Falidi. It's good to hear from you, a doctor practicing in the sector. I think you're the best person to tell us what is really happening there. A doctor practicing in the private sector. Could someone mute? There is a lot of noise in the background. If your microphone is, yes, thank you. It's good to hear from you, Dr. Falidi, a doctor practicing. You're on the ground. You can get to tell a lot about what is happening in the health sector. You have a picture of the government setting and the private setting, and it's very good to hear from you. Thank you so much for the insightful presentation. May I now introduce our second presenter, Mr. Edward Lubega, who will now present on the challenges that are affecting innovations in the digital healthcare space in Uganda. Remember, Edward is an IT specialist, and he's also a data analyst. He's been working in the edutech sector for a period of 10 years now. He has a lot to share with us. Over to you, Edward. You're most welcome.
Yeah, thank you so much, John, and good afternoon, everyone. My name is Edward Lubega. I'm glad to be here to also contribute to this noble cause. Thank you so much, Dr. Sanyu, for your very informative presentation. I will request that you give me the right to share. I have a presentation. Can someone help me share?
Yes.
Okay, are you able to see my presentation?
It is
yes.
sharing. Yes, we are able to see it.
Thank you.
Okay. Yeah, thank you so much. So, like I'm already introduced. I'm from Uganda, and I work with an edutech company called Cyber School Technology Solutions. And I'm so passionate about digital interventions because I'm certain of how much value it can avail to not only the patient's community, but actually when it comes to digitizing things, actually it affects all sectors. So I'm from Uganda. I think let me do away with the video so I can. Okay, yeah. So Uganda is the Pearl of Africa. I think I need to tell you about that. It's the Pearl of Africa, and that name was given to us way back in early days of the explorers. When they moved around, they found Uganda very interesting. And that's how they ended up saying, Uganda is the Pearl of Africa. So we are in East Africa, and in the east, we border with Kenya. In the north, we border with Sudan. Then in the west, we border with DRC Congo. Then southwest, we have Rwanda. And in the west, we have Tanzania. So basically, that's Uganda. We're a country with 44 million people. And 80% of those people are below the age of 35. So Uganda is quite youthful. And we have very few old people, 0.5% are above 80 years and above. So, and the average household in Uganda is basically 5 persons. So basically, that is something that I thought I needed to share with you before I delve into the subject of the day. Yeah, so I'm here to talk about the challenges that affect innovation in digital health in Uganda. So my approach is quite, I provided the bottleneck or the challenge. So this section will be tackling the challenges. Then I'll give you the state of affairs, how things are in as far as that issue is concerned. Then I'll tell you what is missing, and then suggest recommendations. So to begin with, we have a leadership and governance challenge when it comes to the digital health in Uganda. Like you heard from Dr. Sanyu, he said the digital health agenda and governance functions at a national level and is executed by it's called the Health Technical Working Group from Ministry of Health. So basically at national level, there's a plan, there's an agenda that is being coordinated to provide leadership. What is missing in as far as leadership and governance is concerned? One is that the digital health leadership and governance at the district and community levels is not clear and is not coordinated. There is no communication, there is no linkage between the national and the community and district level digital healthy practitioners at that point. Then there is a difficulty in information flow between various levels of the health systems, so leading to poor performance. So basically, because there is lack of that consistent cohesion between the national task force for digital health and the local communities. So there poses a challenge to us. So what are we recommending, or what I basically recommend, is to provide linkage between the national level digital health, and that is a technical working group, to the community health systems. So that is challenge number one. Then number two, when we talk about the e-health enterprise architecture, the interoperability and standards, you very much know that when you talk about e-health or digital health, there has to be a platform to run these different applications. So there is basically a challenge when it comes to the architecture, then the interoperability and standards. In as far as that is concerned, the current status, the digital health platforms or applications are in place in Uganda. Like you heard from Dr. Sanyu, he said we have quite telemedicine, we have quite a number of interventions in this area. And there are also some standards in place. To mention just a few that talk about like e-health, we can point out the standard systems and software engineering standards. Then there are standards concerning the structured cabling and many other standards, which I've listed in my last slide. We'll get to see them. But what challenges do we have in as far as the architecture, interoperability, and standards are concerned? One, there is, because these systems are standalones, information sharing between these applications is not possible. So at national, for example, between districts, these systems are not able to communicate. So information is not coordinated. So that poses a challenge that needs immediate attention. Then the other observation is that the standards have not been reviewed specifically for e-health. Yes, there are standards for data management, standards for software development and running softwares, but they are not customized to serve the e-health or digital health. And that poses a challenge, and it needs immediate attention to really structure the standards to address e-health. And as a result, again, because these systems are standalones, in this I mean they work in isolation. You find that a system in one district cannot communicate with the system in another district, and for that reason there is gap. And if a patient is first seen, for instance, in the western part of the country and is transferred to the central part of the country, and he's got to, unless he moves with a physical file, the systems are not able to communicate to simply read what was initially diagnosed, so that this person does not undergo the same process that he already went through when they first got the diagnosis. So there is a challenge in that area. And what do we recommend? The recommendation is that there is need to develop and operationalize a national enterprise architecture and a comprehensive and interoperable digital health system that is able to communicate to like one system where all information can be accessed on authorization. Then there is also need to develop standards specific to digital health. Then the next challenge or bottleneck that deters or affects innovation in Uganda is something to do with the infrastructure. The current state of the infrastructure in Uganda, when it comes to connectivity and networking in Uganda, almost 100% is covered. Covered, and this includes the rural district, urban and remote areas. And this is achieved through the fiber optic, the fiber optic provisions in big towns, and the rest of the remote areas, at least they have the wireless connection or connectivity for the rural areas, remote areas, and districts. So that's the current state. So it's not so alarming. But where is the challenge? The missing link here. Mobile phone penetration in the country currently stands at 57.6%, and internet penetration is 38.8%. And majority of the phones that are in the country are not smartphones. So that again poses challenges when it comes to working with applications. So they cannot accept making calls, but the ideal situation would be that majority of the population have the smartphones and are able to access the applications when is needed, more especially the doctors, the nurses, and the likes, the medical practitioners. Then the other challenge, in as far as the infrastructure is concerned, is the cost of internet. It is still so high, and that coupled with the power supply in lower health units, because we understand that some areas do not have reliable power sources. And besides that, some do not have power at all. Remote areas, they don't have power at all. So that in a way affects how innovation and use of e-health in Uganda. And the other missing link is the ICT hardware. These computers are very few and at times poorly maintained. You get to some health facilities and these gadgets are gathering dust. I mean, like those few, maybe that one will come out in the next point, but the few that are there are also not put to proper use. So the recommendation is that we need, like as a country, when we need to intentionally tap into the mature technologies such as the cloud computing, big data, and open data, data analytics, smart systems, digital services, and Internet of Things, to make sure that we optimize technology to helping people wherever they are using this free space. And the other recommendation is that we need to develop an intentional program to bring down the cost of internet, because as long as internet is still so high, costs are still so high, sinking systems, healthy care applications will become difficult and very much challenging. Moving forward, again, we need also to venture into alternative power sources for rural healthy units like solar or generator, to be able to make sure that these like the gadgets that are provided for work are able to run as and when they are needed. Then when it comes to the human resource and capacity building, there is another challenge. This is another bottleneck to digital healthy innovation in Uganda. How is it? Maybe to first understand the current status. Most health workers and patients are not computer literate. That's for a fact. They went and did medicine. They are skilled in their areas of specialty, but the enabler, which is the technology, most of them are illiterate and they need much help. And the other thing is that healthcare organizations have struggled to attract, train, and retain e-health and IT professionals, more especially in the rural setting, leave alone Kampala, the capital, where we have big hospitals, where they can afford to have one in charge of ICT and one equipped or well facilitated to run a well-equipped lab. But I'm referring to those remote districts, those remote areas. We are so incapacitated that there is no talent required to run these IT applications and also to run these IT gadgets that are required in the digital healthy field. Then, so the missing link when it comes to healthy practitioners, the positive attitude. Most nurses and doctors feel overwhelmed by their routine work and feel that the ICT is an extra burden that will draw them away from their core duties. So as a result, they pay little attention to learning things to do with computer and technology. And this is a huge challenge. I've operated in the edutech world. I've encountered this same challenge where people are resisting technology, thinking that it consumes a lot of time, yet they have to pay attention to maybe their daily routines. So again, there is some great work that needs to be done, not only in Africa, in as far as human resource, the healthy workers and the IT professionals to be interested to get into this area. So what are we recommending? Government needs to provision an e-health workforce structure and an e-health skills framework to guide curriculum development for e-health. What do I mean in this? We need to begin to incorporate like tailor-made kind of curriculum for doctors and nurses and clinical officers to come out so that by the time they get out of the universities or training centers, that they are well abreast with technology and are not tech phobia in a sense. So that has to be a deliberate move by government to make sure that there is a healthy workforce structure and e-health skills framework to guide the curriculum development for the nurses, the doctors, and the clinical officers. Then when it comes to research, there's again another challenge when it comes to research, innovation, and development. The current status, like Dr. Asanyo highlighted, we have several strides in as far as health-related innovations are concerned in Uganda. We have quite a number of them. He talked about the rocket health application, or he talked about, I'm also here to talk to introduce to you the call. There's what is called the Call the Clinic app, Call for Life, Calm Care, electronic infectious disease surveillance response. There are quite a number of them, and we want to applaud the effort in that direction. But where is the missing link? One, there are no structured and centralized, there is no structured and centralized funding for e-health research, innovation, and development. So basically, there is nothing like, there is no funding. Secondly, the fragmented effort in e-health research, innovation, and development. You find that people work in isolation. You sit somewhere with a few people, with your company, work out something. Before you know it, someone else is working out the same, like replicating the same effort. So I think that is another challenge. And then we have insufficient collaboration between innovators. And there is also the high cost of innovation space, computing resources, access to online material, and internet bandwidth. So those are the missing links. So what do we need to do? There is need to map out all innovators in the digital health space in Uganda. 2, there should be a grant availed to support research, innovation, and development. And 3, there is need to build synergy among innovators. There is no need to invent wheels. If you find your colleague like at a stage where it's already invented the wheel, can you do something else? Can you build on the past effort to make sure that we have kind of synergy and an intentional program to really be super when it comes to this area? Then my second, I think this is my last. Do we have legal or laws governing digital health in Uganda? There is a note or a disclaimer here. Currently, the legal and regulatory framework comprise of several laws and regulations which support, but are not specific to digital health. So as we talk now, I've listed them here. You can see there are laws, there are policies, and strategies. All these speak to the digital space, Computer Misuse Act, the Electronic Transaction, electronic signatures. There are quite a number of them, of which I'm not going to go through, and I know we already have a council here who will be able to highlight more on this. But we have laws, we have policies, and we have strategies in place that can help guide. Only that they are not tailor-made to serve the digital health needs. So at this point, ladies and gentlemen, I want to say thank you so much for your time and attention. Basically, that's what I was able to identify. And I know there is quite a lot that needs to be done. And I think together we can put out strong recommendations that will not only help Uganda, but also other African countries, because I want to think that we somehow have similar challenges. Thank you so much, Joanne. Thank you so much, the conveners. Over to you.
Thank you very much, Mr. Edward Lubega and Dr. Fadili Sanyu. It's been good to hear from you. Very detailed presentation. Very, very, very good to hear and get to know what's happening in Uganda. And at this very juncture, I would like to call upon questions from our fellow, from the participants that are online here. There is a question to you, Mr. Edward and Dr. Falidi. Do you have, sorry. The question is, do you have an insight into possible investment opportunities in Uganda's digital health sector? And where can we start with addressing solutions in the Ugandan digital health ecosystem? Someone says he's really curious about that. And is there a path towards addressing the different problems, e.g., power, internet connectivity, etc.? And another question was, no, I think that is all, unless if we can get more questions from other participants. But if you could handle those two questions, Mr. Edward and Dr. Sanyu, then we shall be glad to go ahead. Thank you. Do we have Dr. Sanyu still online?
Yes, I am on.
And do we have Mr. Lubega still online?
Yes, I'm online. I wanted Dr. Sanyu to come in first, then I'll come and take him.
Yes.
I wanted to get the question very clearly. Do you have an insight into
possible investment opportunities in Uganda's digital health care sector? And where can we start with addressing solutions in the Ugandan digital health ecosystem? Those were the questions.
Okay, yeah. Like us who are in private setting, is everybody hearing me? Hello?
We can hear you, we can hear you, Doctor.
Yes. Like us who are in private facilities, there is still a gap, like there is still room for investment in applying even these systems. Like most of our healthy facilities in our private facilities don't have this the computerized system where a patient clocks in and they're already in the patient system. As we said, they are still more in Kampala, not everywhere, but there are places that come close to Kampala like Mukono, even Jinja, even the Entebbe, where still big hospitals are still using small papers. Like there is still a lot of space uh, uh, where to put focus. And one of them is building up these systems that can capture a lot of patients' data and store them and retrieve them easily in case a patient has come in. The other question was where to start from to address these solutions. There are a lot of challenges that my colleague talked about, but one of the biggest challenge, as he said, is even the health workers themselves find a lot of burden. For me, I told you I will be talking about practicing. Find a lot of burden to get into this computer and even type in patient's name that this patient, okay, is on this treatment. Like for example, a nurse has to give treatment to the patient and then record. It's easier for a nurse to give the patient treatment and record on a paper, but it will be hard for them to, after giving treatment, to go on and record in a computer system that, you know what, I've given this treatment at this time. They feel it's an extra work. They feel another person that is well covered with ICT should be put up in the hospital to do that work for them. So where we should really start from addressing the issue is from school, like from the training schools, from where we come up from. Like a lot of work is supposed to be done. Even our patients, we are lucky, maybe we have got those who are literate. They should also have knowledge about what is, or about the computer, like, because some of them get mad in case you're just typing the information in the computer. They're like, this person is not giving me attention. I expect a lot of work to be put on paper, but it's taking a lot of time putting it in the computer. So there is a lot of work to be done in sensitizing, in educating both the practitioners in health and even the patients. And maybe they get used to the system, because currently a lot of patients, not even far away from rural areas, but in government facilities, they are used to their papers, a lot of paperwork to be given to them, a lot of paperwork to be documented, to realize that maybe, oh, my disease has been too, I was very sick. Can you imagine the doctor had to write a lot of paper and even flip another and write another one. I think I was very sick. The same thing with my results. They were very sick. They do not want this electronized system. Yes, that's what I can say about these two questions. Thank you for listening.
Thank you, Dr. Sanyu. It's very good to hear from you, the man on the ground. We believe that you have a lot to tell us. Can we hear from Mr. Edward Lubega? A question here is for you. Keeping IT and e-health experts were considered challenges in Uganda digital health sector. What can the government and other private sectors do to reduce the overturn in the sector? Thank you.
Okay, thank you so much, John. To begin with the first question that came through Tony Ajiboye, hope I've pronounced the name right. Okay, I can assure you that when it comes to digital health in Uganda, is still a virgin area. And there are many people who are in need of this service. I can tell you that even at a level of ministry, they are beginning to wake up towards embracing an all-inclusive digital health agenda. So whether the opportunity is there, yes, the opportunity is there, and the possible investment, I think what we need to do is one, to clearly state the value proposition of e-learning investment, e-learning initiatives to not only hospitals, but also to governments. They get to appreciate it because it's until they have understood fully how much value they get when they embrace digital health that they will give you the ear. Then we need to be able to articulate clearly what the problem is. And after that, we will be able to really have their buy-in, and we'll be able to work with them. So we can go through government, we can go through private, we can have private partnerships and be able to come up with innovation. So it's a matter of, we can have a follow-up kind of meeting and deliberate on this, but they are quite a lot. It's a virgin environment that requires quite a number of innovations. Where do we need to begin? Yes, I've told you. Understand the problem, provide a solution. Then the other thing will be funds, fundraising, because digital health, I've worked in digital spaces for quite long, but it requires money, millions of dollars to come up with a system that can really help when that big magnitude. So that's what I can say as far as Tony's questions are concerned. Then the last question, Joanne, you said it was about what? Beg your pardon.
Let me read it again for you. It says, keeping IT and e-health experts were considered challenges in the Ugandan digital health sector. What can the government and other private sectors do to reduce the overturn, to reduce the high turnover in the sector? Yes.
Okay, thank you so much. I think what government needs to do, one, I talked about a long-term kind of approach, which has something to do with the curriculum, like guiding the curriculum development that trains every person going to practice in the medical world to have sufficient knowledge in as far as ICT is concerned. So that is a long-term initiative, and governments are meant to do such things. Now, currently, tentatively, what can be done, because I know the talent is in place, like the IT professionals are in place, but they're paid much higher, like much higher than what health institutions are willing to pay them. And I don't see what government needs to do is to consider paying them a deserved fee to attract them, because this is about attracting them. So how do you attract them? You attract them by giving them a competitive pay, and that will help to deal with their high turnover in this field. Over.
Yeah, thank you so much, Mr. Edward Lubega and Dr. Sanyu Falidi. It's been interesting to hear from all your presentations, very elaborative, very detailed, and very interesting to learn from. At this very juncture, I would like to go ahead into our second session, where we shall have again two presenters. That is Faith Acheng and Council Nimsima Brighton. Faith will take the first presentation, which will focus on specific policy changes that could transform digital healthcare space in Uganda, how to overcome the challenges. And after Faith, we shall have Council Nimsima Brighton, who would also make his presentation, which will focus on how to overcome the challenges that are affecting innovations in the digital healthcare space in Uganda. Here we want to talk about the legal and ethical challenges and the role of public regulations in the advancement of digital healthcare, digital health in Africa. You're most welcome, Ms. Faith Acheng. I hope you're still online. Kindly unmute and give your presentation.
Hi, I'm Faith Lydia Acheng. As lately introduced, as I'm introduced as a person from Uganda, a council and a women leader, Kawempe Women Empowerment Program. I'm going to go off the video as we communicate. Okay, if we talk about the regulations on digital health, we have all talked about the challenges, how to bridge the gap, but we haven't addressed our minds on what digital health is. I will briefly talk about that, and I will tell you how it helps before I give you the regulations. To me, I take digital health to be use of computing platforms, connectivity and software, and sensors for the healthcare and related users. This is where we use, like, when we talk about computing platforms, we talk about telehealth, which includes mobile phones. We talk about mobile health, which includes the movement of like vans and ambulances from one place to another in order to provide the services to people. How does digital health help? Digital health helps the healthcare providers to practice patient-centered care, ensuring continuity of the care. Then this streamlines and improves the timeline and access of healthcare to the users everywhere. Meaning that when we look at digital health, we look at this point where our patients can access healthcare anywhere, wherever they are. But there is this challenge where people are in remote areas. They can't contact doctors, and sometimes the network is on and off. Just take an example of someone contacting a doctor. Let me take an example of WhatsApp. You contact a doctor, you send a message, and it blue ticks, or it double ticks after something like an hour. The medics are here. If we talk about pressure, by the time you respond, the patient may be gone. Okay, for that, if we talk about the regulations and digital health, we can, excuse me a little bit.
Is everything okay, Miss Faith?
I had to control some people home here. So,
all right.
Innovations, especially here in Uganda and Africa at large, we can't leave out the public health, and we can't overlook the fact that are handling public health. Here we will look at the promotion of public health and health equity in Uganda, according to my section. In Uganda and Africa at large, the Constitution is the supreme law. I think we are aware of that. The constitution is the supreme law of the land. And mainly it focuses on, we are focusing on South African countries, which include, because when you were talking to me, you told me about Uganda and Africa at large. But here I'm focusing at East South African countries, which include Mozambique, Swaziland, Uganda, South Africa, Kenya, Tanzania, only to mention a few, but there are many. As a result of public regulations, the support of digital health innovation and human rights have incorporated the international and regional human rights. Here we will look at, in Uganda here, the extent which health rights are neglected or promoted is a major factor in promotion of public health and health equity in Uganda and Africa at large. According to the Constitution of Uganda, Article 2, it states that, let me read it. We read the law from the source. It says that the Constitution of Uganda is the main The Constitution of Uganda is the supreme law of Uganda and shall have binding force on all authorities and persons throughout Uganda. That is Article 2 of the Constitution. And Article 2, Clause 2 says, if any law or any custom is inconsistent with any of the provisions of this Constitution, the Constitution shall prevail, and the other law or custom shall to the extent of its inconsistency be void. What does this mean? That any law that should come out as a regulation in Uganda should be binding with the laws of the what? Of the Constitution. Our Constitution in Uganda here, we have an objective, which is Objective 22. Objective 22, which talks about medical services, and it says like this: the state shall take practical measures to ensure the provision of basic medical services to the population. Meaning, in Africa, all laws are made but should be binding to the what? To the Constitution. Meaning that our Constitution is the main law of the what? Of the land. But we can't forget to talk about other laws, like legislatures, and there are also, as we were saying lately, the Computer Misuse Act, the Allied Health Treatment Act, the Dental Practitioners Act. However, Africa, our digital growth is so slow. If we talk about,
Miss Faith, just a second. If you would try to round up, we are almost getting out of time.
I beg your pardon?
If you would try to summarize your content, we are almost getting out of time for the next person to present. Yes, are you still with us, Miss Faith? I think we have lost her. Are you still with us? Could you try to summarize and we hear from the last presenter?
Okay, let me summarize this way. We have the principal laws. In these principal laws, we consider the health organizations, the digital health broad umbrella.
We can't hear from you, Miss Faith. I think we shall try to see if we can get back to you. At this very moment, I would like to call upon Council Nimusima Brighton to make his presentation, and you're most welcome, Council Brighton.
Okay, thank you so much, everyone. I hope you can hear me. Yes, Joan.
Yes,
Yes,
I
we
can
hear
hear
you.
you. Please go ahead.
Okay. Okay, thank you so much. So I would like to first of all highlight a few things about the presentation of my colleague there. That's Madam Faith. About the few regulations that have aided or have helped this digital healthcare and healthcare space in Uganda. Earlier on, is one of the participants, one of the speakers, two laws. But to just be brief, as I come to my area, is that what we have the 1995 Constitution of the Republic of Uganda. This Constitution will lead its national objective and objective of state policy. They mandate uh, the government, the state, the Uganda to ensure that healthcare services are brought closer to the people. And in this mandate, we realize that digital healthcare has space. So that is one thing I wanted to point out. Second is that there are some specific laws that help or that aid uh, digital health space. One of them, highlighted by the participants, was the electronic transaction charge. Like we had earlier stated that these things are either done for internet and then computers and so forth and so forth. So you realize that you may need to transact. So the electronic transaction act helps you to make these transactions with the doctor, with healthcare, the hospital, whatever it is. So the electronic transaction act helps digital healthcare to that extent. Then there is the electronic signature act. You may find that signatures are important. For example, in our field as lawyers, when you have to represent the medical doctors and post their made signatures are very important. So the electronic signatures act helps.
Excuse me, Council. You're not clear, and it's hard to hear what you're saying. Is it because there is some noise in your background? People cannot hear what you're saying. Pardon?
But it's still so loud. Are you able to hear me now?
No, your voice, you're not clear. We cannot hear what you're saying.
Let me just. Are you able to hear me right now?
Yes, now we can hear you.
Okay, now I was saying that we have the Electronic Signatures Act. That act helps us to make signatures online. Since we are doing this digital health and there are transactions, you may need to sign here and here, the patient has to sign. So you realize that the Electronic Signatures Act, in one way or the other, it also aids this digital health. The other thing I want to highlight is that since we are dealing with computers, we are relating with providing these digital health spaces with information, you realize that data is being collected. So there is a law called the Data Privacy Act. This law regulates data privacy because when you read the Constitution, people have the right to privacy. You are not allowed to use someone's information the way you want. So Data Privacy Act, in one way or the other, helps to regulate and streamline how digital health care can operate. Because you find challenges like for us lawyers, client will come and tell you, I provided my information on this application,
and my information was used somewhere, it has disturbed me. So to avoid all those things, that Privacy Act of 2019 is also a very good law that you should look at. I also like to point out on the Computer Misuse Act. Now, this law has currently been amended. The President recently signed the amendment 2022. This law helps stem those people who may misuse the computers, even in instances where we are dealing with digital health space. So those are the few laws I wanted to highlight on, though it's a lot, but I wanted to point out those ones clearly. And basically, privacy, misuse of the computer, since we'll be dealing with computers and phones and so forth. Now, I want to come to the last part, which is what I'm supposed to be handling. That is the recommendations. What is the way forward? I want to appreciate there's a participant, the panelists who try to do some good recommendations. I don't want to waste a lot of time. I entirely agree with the recommendation he suggests, but just add on these few. One, we need to have digital health standards. Yes, we need to have these standards because the Ministry of Health, other stakeholders, they must sit together. The general public, the parliament is there, and then we can agree on some guidelines, standard operating procedures on how digital healthcare can operate, which devices, which networks, connectivity and use, yes, security and privacy. We need a law that encompasses all this, not just borrowing from what already exists. We need something that specifically caters for digital healthcare. And to do that, we need to engage Parliament, find where to have a law enacted specifically on digital health, such we don't have these conflicts and lacunas in the law. The other area is a digital health architecture. It's needed. We need to know who are the stakeholders, get it, what role do they play, and this will help to further develop this digital health care space. Then the other thing is capacity. The people involved with digital health care, we will have the general public having the patients, then we'll have the doctors on different levels. We specifically call them doctors because that's what we address them as us. But what are those specific capacities they have? Because these doctors we have, you realize most of them cannot even operate some of these phones to the extent that digital health is concerned. So we may need to train them, we may need to equip them with some skills, and there is also some other important thing that will emerge, whether you like it or not, and that is privacy lawyers. Yeah, just 2 weeks or 3 weeks back, there was a MOOC prepared by Makerere University, though it did not relate to digital healthcare, but it related to one client who hired a certain company. She needed mobility services. She provided her information. Then later on, her information leaked, went somewhere. So we need lawyers to be brought on board to help in as far as digital health is concerned, because rights are involved here. Rights are there, and you will find their duties, their obligations, and they may arise consequences. So on top of what my other colleagues have said, I want to thank them, and I want to thank you all for the views you have shared here. I have personally learned a lot. So that is what I wanted to share in as far as the recommendations are concerned. Thank you so much, Joanne.
Thank you so much, Council Nisima Brighton and Miss Faith Acheng, Lydia. It's been so wonderful to hear from you. At this very juncture, I would like to take further questions from the participants online here to Council Brighton and Miss Faith Acheng. Kindly, if you have a question, put on the chat or raise your hand or unmute and ask. It's open now.
Yes, thank you so much, Joan. This is Edward. And thank you so much, Council Nisima and Council, there's another Council Faith. My question is, when it comes to enacting laws, I understand when the government has no interest in enacting a law, there is what is called, is it the private members kind of bill where you need to sponsor the sessions involved in drafting and presenting, and it's usually a heavy kind of cost. So do you see private organizations or people with the need to have such laws succeeding at this without them being initiated by government? Do you see us having that kind of money to sponsor the private members kind of bill for digital health? Over.
Please, Councillor Brighton, go ahead and answer that. Is Councillor Brighton still online?
Yes, Joan.
Yes, Edward
Hello?
had a question for you. Edward had a question for you. I'm not sure if you really had it or you were offline.
Somehow I broke away from the message, but can you kindly repeat the message, the question for me? Then I can be able to answer.
Please, Edward, go ahead.
My question is, I understand that for Parliament to enact a law, there is need. It is either the motion is. I mean, it is. It comes. It can either come from like the government initiates it, or it can be a private member's bill. And I hear there is a requirement that if you're to front a private member's bill, you foot the costs involved, which are usually huge. Because so my question is, who do you see champion the enactment of digital, laws geared towards digital health? Is it something that can come from the private members?
Okay, thank you so much, Edward. I want to first of all highlight what I earlier stated, that is contained in the National Objectives and Directives of State Policy in the 1995 Constitution. Our grand norm, which is the supreme law of the land, it gives the state and the government mandate to ensure that healthcare services are brought closer to the people, the general public. So this is a matter of public health. It is not a matter of just an individual. And even in the event that it is an individual so much affected, for us, we look at human rights as affecting all of us. And health is a human right. Though it is not specifically enshrined in the 1995 Constitution, but it is a human right. Therefore, I think in the general interest of the whole, of all the citizens, this is something that is supposed to be taken over by the Ministry of Health. And the line minister can table this bill in Parliament. It can be something to do with even in the event that someone spearheads this bill, the government will have to take over, because this is a matter of national importance. This is national health we are talking about. So in my view, I think the government should really handle this. We can be the people who cry out it and have them on board as stakeholders, because it also affects them. I have been trying to look at several reports, several writings from the Ministry of Health to do with digital healthcare. So I think this is something to do with the government. Yeah, that is what I want to submit.
Yeah, thank you. Sorry for coming in again. Briefly, I have personally tried to access the Parliamentary Committee on Health, and I wrote to its chairperson. Again, it was a healthy related matter. where we needed government intervention to really save lives. And there were quite a number of people who really needed saving. But I was quite disappointed by the slow response. Actually, no response. The no response, even after trying to schedule meetings, even after trying to write, and so basically, how best do you see us? Because much as we may be very passionate about this and want to see things done and it's a human right, and they are cognizant of this. However, it's not top of their to-do list. So I'm wondering which avenues we need to collectively think and know if we really want to push this agenda moving forward. Who do we target to get our suggestions quickly aligned? Over.
Okay.
If that question is for me, if it's not for me, I will still air out my view. I think in one of my recommendations, I talked about bringing all stakeholders on board. And I will state again, matters of health, there is nobody in this world, even the president of Uganda, he's a stakeholder. He's a stakeholder. Now, the challenge we have in Uganda is that one, Uganda is a low developing country. It is a low developing country, and low developing countries associated with so many other problems like bureaucracies and so forth. But when you do something like this as an individual, it is more likely not to succeed. But when you bring people on board, like for example, this has been one thing that has brought us on board, the lawyer, the doctor, the specialist in ICT, and others. So this is a public outcry. I think we have to bring all people on board. Nobody should be left out. Nobody should be pointed at specifically. But we as the people, we have to look at this and push it forward. The only way we can do this is by bringing all the stakeholders on board, and we have them. If it means meeting the president, we can find the necessary people to do that. If it means meeting the minister, if we can find the option in this, and people can meet, because I don't think this belongs to anybody. It belongs to all of us. This is public health. It is in the general interest of the what? Of the people. That's my submission. Thank you.
Yeah, thank you so much, Councillor Brighton. I can see Dr. Festus with a hand up. Please go ahead and give your submission.
Thank you very much for all the conversations, Joanne. Thank you very much for that question. I think it's the co-creation of digital health solutions for Africa has to be led by all stakeholders. But I also think the government has a very key role to play in making that decision to respect human rights, as you know, one of our panelists have said. So this is just a comment, it's not a question. But I've thoroughly enjoyed this conversation, really, because I feel like I'm a Ugandan myself now, just listening to all these conversations. So it's really good to see. Yeah, it's really good to see that you know, there are so many stakeholders. You know, our medical doctor is here. He said a lot about you know what they struggle with, you know, as a clinician, as a medical doctor. And then we also have the IT guys, like, you know, Edward, for example, who, you know, works actively in the private sector. So I think it's more, you know, co-creating solutions, but it has to be together, you know, with this kind of roundtable. So thank you very much. Just to chip in to appreciate everyone and to say, you know, I'm really learning a lot. Thank you, Joanne. Over to you. Thank you.
Thank you, Dr. Festus. Yeah, you're most welcome to come to Uganda. It's the Pearl of Africa. I saw Miss Faith, you had your hand up. Please go ahead and make your last submission in the interest of keeping time. Is Madam Faith still on?
Yes, I was supplementing on Council's submission. I was like, if you try writing as an individual, sometimes it may not work, as we have recommended stakeholders to come together, but it's better if you go and write as a ministry, or you contact a ministry, like a Ministry of Health or the World Organization as an organization, then you write up and you surrender it to the Ministry of Health over a particular country, then there it can be a bill and we see how it can be enacted. That was my submission.
Yeah. Thank you so much, Madam Faith. Those are our law experts. We've heard from Mr. Edward Lubega, an ICT expert and a good data analyst, like you have seen. We have also heard from Dr. Fadili Sanyu. He's a general practitioner and also a CEO. He owns a medical center, so that's why he really had a lot to tell us. And we have also heard from Counsel Ninsima Brighton, an advocate at the High Court of Uganda, and that's why you were also able to hear a lot from him. So we've had very interesting people with very interesting presentations. And at this very juncture, I would like to call upon Miss Maria to take up the next session. Maria, you're welcome. Thank you all.
Thank you, John. Can everybody hear me?
Yes, we can hear you. Yes.
Thank you so much for carrying out that session. It was really great and to hear from our panelists. We really appreciate that. Thank you to our dear presenter for your wonderful presentation. Now we just want to take perhaps just one question per panelist, just to keep time also. We don't want to keep you guys long here. I know some of you want to go home and all that. So I'll keep it short and simple. So thank you for your wonderful presentation. My first question, I think I would love to start with Dr. Farid. I hope I'm pronouncing the name correctly. Dr. Farid, I have a question for you.
I am on. Hello.
Okay. Yes, Doctor. I know you have taken a lot of questions. Maybe just one question here, and then we just wanted to know what type of healthcare system does Uganda have, and how is technology influencing healthcare system in Uganda?
What type of healthcare system does Uganda have? Generally, broadly, as I said, we have the Ministry of Health at the top of the healthcare system. In partnership with different NGOs, it runs the policy and the framework that is an idea of the government in power to run. Like they have different policies, like maybe maternal and child health care policies, and policies maybe that come up in case we have different epidemics or pandemics like we had COVID. It's the top most body that tells us on what to do and how to do it. After the Ministry of Health, we have the decentralized services at district levels, all local government. At the ministry, we have on top different suppliers of services, and there belongs the regional referrals and the national referrals. I think that is at the top. At the local district levels, the decentralized system, we have the health center force, the district hospital at top, then health center force, health center 3, health center 2s, and what would have been like a health center 1, they are called the village health team. this one I had to say earlier in my presentation that through different NGOs, these VHTs of recent were given mobile phones and some apps were given to them, like I think ComCare. They can quickly report and notify the health center to all health center these for all. They notify the occurrence of diseases on ground because they're the first people to get maybe in contact. Initially, they had even the ability to quickly test some common diseases like malaria, etc. This healthcare system that I'm talking about is under the government, like it's there are government hospitals where, like one council said, the government says it takes care of everyone's healthcare, basic healthcare system, like basic healthcare. There you go, you clock in, you don't expect to pay anything, you expect to be seen by a clinician. On different levels, they are headed by, like health center is headed by a clinic officer, health center force by a medical officer, district hospitals by a specialist, and then regional referrals administered. That's where you find super specialized service providers. Now, normally someone gets sick, like I said, for me, I'll be talking about what really is on the ground, like how we practice. Normally someone gets sick, depending on the level of their sickness and who to see them, they clock in and interact with a clinician. And at the lower levels, we really have a lot of technology going on. It's mostly use of papers. You see a patient, you clock them, and you write for them, maybe to go run tests. After tests, you prescribe for them drugs. If they are there in a government facility, you give them. If they are meant to be bought from outside, like it's not provided by the government, it's not basic, because what is most basic here is maybe malaria, maybe typhoid, maybe those simple illnesses. Beyond that, you get a prescription and you pay for the drugs outside.
Okay, doctor, I think you have given us so many information that we need today. Like I said, we are running out of time, so I apologize for that. Yes. Thank you so much. I would like to express our appreciation to our panelists for their valuable contribution to this event. It was really a successful one. And our deepest gratitude goes to our participants who attended this session to make it a successful one. Thank you so much, ladies and gentlemen. Good evening, good day. Thank you.
Thank you very much, everyone. We really appreciate, again, all of our participants and our speakers in particular. Thank you so much. Thank you, Maria. Thank you, Joanne. We have a lot of opportunities at the African Center for Digital Health Policy Research. If you'd like to join us as a research fellow, or if you're a PhD student, or you are a business person looking into digital health investment in Africa, looking at any disease in particular, Parkinson's, managing health conditions, detecting any health issues early enough, whatever it is you're doing, would like to hear from you. So please feel free. We have a website. So please feel free to visit our websites and be able to interact with us. Thank you very much, everyone. And we look forward to hearing from you, and we'll be inviting you to our next roundtable. If you'd like the slides, just let us know. Please just drop your email, send us an email. We're also putting our email in the chat if you'd like to receive the presentations or the link to watch the video. Thank you very much. What's the symbol for peace in Uganda? Is it this way as well, or is it how do you say goodbye in Uganda? Joanne, how do we say goodbye? Thank you very much, everyone. What's the word to say goodbye?
Everyone.
Goodbye,
Bye.
everyone. Thank
Bye-bye.
you.
Bye for now.